This is something that I've often described, Steve, and not to be hyperbolic about it. It really is the perfect storm and an infectious disease and public health person's worst nightmare. It's a spectacularly transmissible virus. The efficiency with which this transmit is really striking. In addition, despite the wide degree of variability from a certain proportion, up to 40% of people who get no symptoms, up through and including people who get sick enough to require intensive care and dying. That is a very complex situation to really get control of. We stayed at a certain level of about 20,000 cases per day until recently, when unfortunately, southern states, which had not been previously impacted to a great degree, California, Texas, Florida, Arizona, are now experiencing surges of infections that have gone up to 30,000, 40, 50, and most recently, a total of 60,000 new cases per day. We need to get our arms around that, Steve, and we need to do something about it quickly, because if we don't, there's a possibility we may be seeing surges in other areas. So we're in a very difficult, challenging period right now as we speak. So rather than think in terms of reverting back down to a complete shutdown, I would think we need to get the states pausing in their opening process, looking at what did not work well, and try to mitigate that. I don't think we need to go back to an extreme of shutting down. We can't just say all or none, which is what happened. We went from shutting down to opening up in a way that essentially skipped over all the guideposts. That's not the way to go. We've got to rethink that and do it differently.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.